What are the costs of IGRA tests for tuberculosis? Have you ever wondered about the costs associated with interferon gamma releases, ASI tests for tuberculosis? The price of these tests can vary quite a bit based on several factors. Generally, you can expect to pay between $50 and $150 United States dollars for an IGRA test. This range can change depending on where you are and the specific healthcare setting. Several factors influence the cost of these tests. The brand of the test matters. For example, QuantiFERON TB Gold and T-Spot TB are popular brands, and their prices can differ. The volume of tests a lab processes can also affect pricing. Labs that perform a higher volume of tests may offer lower prices. Additionally, some hospitals or clinics might have package deals or discounts available. When you compare IGRA tests to the traditional tuberculin skin test, you will find that IGRA tests are usually more expensive. The tuberculin skin test typically costs under $20. However, IGRA tests have their advantages. They only requiring one visit for testing, which is more convenient. They also have higher specificity, especially in individuals who have been vaccinated with Bacillus Calmette Guerin. Insurance coverage plays a significant role in the overall cost for patients. In many places, health insurance or government programs may cover the costs of IGRA testing either fully or partially. This can significantly reduce what patients have to pay out of pocket. It is important to note that costs can vary globally. In low- and middle-income countries, the price of IGRA tests may be too high for widespread use without financial support. In contrast, high-income countries often use these tests more frequently despite their higher costs. Understanding the costs associated with IGRA tests is crucial for both tuberculosis control programs and patients. These tests are essential for accurately detecting latent tuberculosis infection, especially in populations that have been vaccinated with Bacillus Calmette Guerin or those who may not return for a second visit for a tuberculin skin test. In summary, while IGRA tests for tuberculosis are generally more expensive than traditional skin tests, their clinical benefits often justify the costs. The actual price you pay will depend on your local healthcare system and your insurance coverage. It is always a good idea to discuss testing options with your healthcare provider to find the best approach for your situation.